Hello, everyone. Good afternoon, good morning, or good evening, according to your jet lag. So, dear audience, as you know, now we are going to talk on mental health. This is a patient session that runs since 3 years and is a co-joint action of ASCAT steering committee and the ERN-EuroBloodNet. So I'm very happy to welcome you on behalf of those two organizations. And today with me, there is Mary. So I pass the floor directly to Mary for introducing this session. Thank you very much to all of you.
So thank you so much. Thank you, Maria Angela, for introducing me. I'm Mary Kuyampuma, and I'm the current CEO and president of the Global Alliance of Sickle Cell Disease Organizations, GASTO. And I am a clinical psychologist by profession who manages both children and adults living with sickle cell disease, having psychological challenges. And I also teach mental health courses in the University of Health and Allied Sciences in Ghana. Welcome all of you to this exciting session. I'm so excited about this session, and I want to thank EuroBloodNet&ASCAT and ASCAT for organizing this session, because when it comes to mental health, there's no health without mental health. And I'm so excited, and I've seen patients, people living with sickle cell disease go through a lot of challenges, and with mental health interventions, they've been able to be resilient and overcome their challenges, and they are living a good quality life. So I'm so excited about this spotlight on mental health in sickle cell session that we are coming to have today. And I welcome all of you to this session. And I know that it will really be an interactive section, because we have two psychologists who are really going to take us through the challenges when it comes to mental health across the lifespan. And also we have testimonies from sickle cell advocates, from caregivers and patients. And by the time we leave here, we would have learned a lot about the challenges, but then the good news is we can cope and live a good quality life. And we will look at some of the coping strategies that has worked for a lot of us living with sickle cell disease. So thank you so much. Thank you. Angela. Yes.
Yes. So after your inspirational sentences, it will be hard to add something, but thank you for your great explanation of today's aims and objective. So I have the pleasure to introduce the testimonies we are going to have, and the two psychologists that will guide the discussion and present themselves their speeches. So starting from testimonies, so we have from Canada, Biba Tinga. She's a president and executive director of the Sickle Cell Disease Association of Canada, and she's a patient advocate and a caregiver. So she will give her point of view on mental health, so from a mom perspective. Then we will listen to a patient advocate from Portugal, Décio Temporairo. He's member of the association, hope to pronounce it properly, Associação Portuguesa de País Doente com Hemoglobinopatias. And he would like to talk about his approach to pain and drugs. We have seen also in the previous session that it is a very crucial point. Then, so with us, we have also the two speakers. So we have Dr. Gabriela Medin. She's psychologist and psychoanalyst at the Hospital General Universitario Gregorio Marañón in Madrid. She works basically with children and teenagers, but she's also coordinating a group of listening with sickle cell disease adult patients in Spain. Then from France, we have Dr. Adrienne Lerner. She's a clinical psychologist at Hôpital Louis Mourier in Colombes in France. And she's also part of the French National Network of Psychologists specialized in sickle cell disease that is called PSI-TREP. They are going to talk about the challenging of living and growing up with sickle cell disease from a psychological point of view in all the life phases, so childhood, teenagers, transition, adult, and becoming parents. So I wish to all of you a good session.
Hello, my name is Décio Temporário, and I'm here before you today to mention something that was very important to me, and a good little friend of mine gave me this idea of taping it, something that I wrote a long time ago. You know, we as patients, we already trying to bring our voice up and to be properly heard, to help some international or landline organizations that are doing their best in our behalf, sickle cell and thalassemic in this case. In my case, one part of mine, I'm truly thankful for it, because I know if we persist with it all together, the future generations that will come will probably be more aware of this awful and problematic disease. And hopefully, with better guidance and respect and access to treatment, this all can be better. My personal experience with this sickle cell and thalassemic disease is like, it's awful. The cause itself, the understanding of the situation along the time, the rejections, the conscience about the realness of it, the deep scars that this disease leave inside us, not only physical but most of them mental. It's dubious. It's not even imaginable. And we say that our physical part is hurt, but our mental part get worse than our physical. That's what I think. So living with all these diseases in my life, I felt a necessity to build up another persona that will take this on an easy way, getting up 8 times or falling 7. That was me. It's not easy to live inside a constant broken body. You have somehow to have the courage to build yourself up and up again, because there is nothing else you can do about it, actually. Well, some of you will say, yes, you always have a way, just accept your conditions and it will definitely be easier. We have a choice, and for me, we have 2 choices. Sink in the given information that they gave you, shut our mouth and transform your thoughts and try to see if it fits you, or can be a little bit like me. Constant frustrated about what I have, because you do not see yourself and accepting yourself as a persona that simply cannot do certain things. I didn't accept that for myself, and it continue our path as hard as it can be. I always believe that I dictate the end of myself or my journey in this world and not the disease. Well, for most of part of my life, I chose the second one, the second part, just to be me. Fall 8 times, get back 9. Try that type of mentality that gave me the boost that I needed and the attitude that I needed back then to go out there and actually explore the world as someone without my conditionals would do normally. Well, I played football when I was a little child, surf, I did jiu-jitsu for 22 years. I played basketball as higher level, as the highest level you can get. I played pro for 4 years. So for a long time, I pushed myself to the limit, living on the edge. That's the fine line between going to have a crisis and not. The total danger of it, but the will to strive better, study harder, and put myself in a position of a choice. That choice, it's an harder one to complete it and try to get it, but is one of that if you work hard enough just to prove it to yourself most of all, but to all the other people that live beside you and see you on your own journey, people that are important to you as well, see that you are stronger than a label that they give you when you're like 4 years old, when I was me, or when you're born. This mentality brought me a lot of goods. I can't deny. But the way I used my knowledge about certain things, I kind of danced with it, and that broke me inside out. So I'm here today tell you that I'm very lucky. I'm a survivor. We all are. But I'm here today as someone who struggled a lot and still struggles a lot mentally. I was addicted to painkillers for a long time. I was that someone that took the word reckless to the max, and it got me to this stage. The understanding of your behavior as a sickle cell and thalassemic patient grows inside you, so you kind of learn how to cheat your body and your mind to certain things that you normally can't or shouldn't do. That's what we do as patients. In my case, was the painkiller stuff. I was very aware of what I would take from that, because I wanted painkillers to go on and just do the normal life that I always wanted to. But I knew if I had a little bit more pain than I had, that could escalate for much worse, and that was a wrap for me. So I overused painkillers just to help me get the right way. No step backs on building my empire, my practice, my clinic, my dream job. working with athletes, that was always my thing. My contribution as a citizen too, as a man, as a husband, and most importantly, as a father. If I'm not able to share with my daughter what daddy had to do in certain points of my life, and if I can be honest about it, I'm not teaching her nothing. I'm not teaching you nothing that you already know, right? So all I wanted was to keep the ship on the right path, avoiding it from sinking, stay away from strong currents, and be able to give my all hand for the ones I loved the most. That was for the ones I love the most. I did that for them, and I do it for them. Okay, and I don't regret it, because if you ask me if I do it again, yes, I'll do it probably again, the same things. So sickle cell crises are just beyond the manageable, with frequently crucial, exuberant, uncomfortable pain. Meds like morphine did not help me at a certain time, so I began to use fentanyl mixed with morphine. As the days went by, the overuse of these drugs got worse and worse. Deep inside, I knew I was doing the wrong way, but when you enter a path that you got to be always available and suitable for work, or just for a minor family activity, it's so easy to ignore these facts and just get along with it. But what I forgot is sometimes we are not capable of holding that kind of things for much longer. So, and I couldn't control it. I lost control about it. No excuses, but it became an actual addiction of those painkillers, a big problem, and I didn't know how to resolve it, or better, how I got the proper help with this problem. Simply because I was so ashamed of what I did, and so ashamed the spot that I had in this community as an health professional too, to a father. I mean, and using it is just too imaginable. And be able to hold on the pain that I constantly felt a little bit longer than before, that's the main thing. But also to make me rest a little bit better, forgive the problems, and just simply fade away in the rest. By then, the lack of sleep and the overuse of the pills got me to a resort far worse than I possibly accepted. There was a terrible scenario, actually. From last year's rhabdomyolysis, acute muscle destruction, to organic sepsis that generated hepatic and kidney failure, to lead to 2 complicated heart attacks. Not done with it, after a long time of dialysis and blood transfusions, I got bilateral pulmonary embolism, and our late friend COVID too. So it was very, very bad. But God didn't left me, and my closest ones too. They didn't abandon me, nor judge me. One thing that I was afraid of was this situation that I could have avoided. Was this episode a reflection of my behavior? Yes and no. I'll say yes because I was reckless with my medication, and the way I used it, and the mindset of putting everyone and everything else before me. For that, yes, and no, because only God knows what will happen to you on a certain point of your life, and I experienced that very close, even with good choices. So today I can look back at it with a more mature and solid mindset that I could not develop till this awful experience. I'm still fighting, I'm still figuring things out, not because I know that I'm a warrior, but because I want more from this beautiful life. But I want to be just a simple, humble man. Luckily, now with a multidisciplinary team, the hematology, the cardiology, the neurology, physical therapy, the psychiatry, the psychology, and the pain management, all of these multidisciplinary teams are helping me actually manage the puzzle on my lows and empowering my highs. Keeping this balanced, not easy. It's not easy. It gets frustrating. As sometimes you don't see that you are that grateful enough or lucky enough to be here in this earth for the things that you did, for the reckless behavior that you had, and for that I say that mental health is one of the causes of our sickle cell and thalassemia crisis, for sure. And we at patients, at some point in our lives, we are always going to have problems, desires, or whatever it may come across. But as human beings, you are going to fail for the most part of our journey. That's a part of it. By failing, you learn. And by learning, you upcome yourself. Right? So be thankful. Because the beautiful thing that we got to understand and actually believe in is that we are not alone in this. We have family, we have friends. In my case, I have a super human hematologist. That's a superhero. That's from another planet. And all of them love us unconditionally. And they are so supportive, even when we think we are being misunderstood. This part of people, doctors included, are here for a good reason, to help you along your journey. And now I choose to believe whatever your problem may be, because there are a lot of different types of problems and approach of it. I don't say don't copy me, because don't copy me. My life was good, is good, and it's gonna be good. But it's my life. Even you with your life, with your struggles, you can see the sun shining. So stay healthy, stay strong. God bless you all.
Yes. Thank you so much, Desio. That is very inspiring. And thank you for giving us some of the protective factors when it comes to mental health. You talk about self-awareness, getting knowledge. You talked about self-acceptance, accepting the condition. And that leads to knowledge, getting to know more about the condition and all that. Then you also talk about support, the emotional support that you need. And what amazes me is, yes, you talked about family support, how family can help prevent mental health illnesses, and also the support group, the patient support group, the importance of patient support group. Thank you so much. And one of the things that I also got from your interaction was the fact that if mental health issues are not dealt properly with, then it means that the medical complications become small and people healer shock. So that's where the narcotics and all that comes in. But if the mental health issues are dealt with, then it means that the person would have less physical symptoms, since mental health issues comorbid with the physical condition. Thank you so much. This is very inspiring.
Today, I'm going to talk about sickle cell and mental health. Living with sickle cell disease is hard. You learn from a very young age to deal with pain, fear, and so many broken dreams. The everyday experiences of childhood can become traumatic triggers. Things like cold wave, heat wave, or physical activity like swimming or playing soccer, to attending a social event like a birthday party. And when a crisis is triggered, it can end up in hospitalization that will require multiple injections for the treatments. Dealing with sickle cell means so many physical symptoms like fatigue, anemia, tissue necrosis, bone necrosis, leg ulcers, difficulty breathing, fever, and so many other complications. And with the absence of treatment to deal with the sudden crisis, the only effective pain medication are opioids. Now, what parent doesn't stress to know that their child is on opioids? They are not only highly addictive, they are also very difficult to get during a legitimate crisis, due to the stigma that comes with the use of opioids. So at any age, all these factors can lead to crippling, lifelong mental health issues. And you have to think about somebody going through their whole lifetime dealing with all these issues and not getting adequate care or adequate support. Of course, it's going to affect them. But this is just the tip of the iceberg. If we dig deep inside to see a few quality of life issues, what does living with sickle cell really looks like? It means not able to finish school or attend advanced education, which also means not having access to health benefits or limited health benefits. Now, how do you ration your sick days if every day is a sick day for you? How do you get a better job when you have to stay close to the limited numbers of treatment centers to have access to care? How do you meet people? How do you have a partner, potential partner, if you are often at the hospital, or you can't go out because of the change of the weather, or because you're simply too tired. How can you be self-sufficient when you need to have a strong network of family or friends to survive? And how do you cope with the fact that you can't attend your child's school play or help them with homework or even their soccer play? Or how do you feel when the family has to cancel their vacation or have to suddenly cancel any program they have because of you? We often focus on the big issues of the treatment, which of course are important, but we forget about the fact, the impact of mental health on these issues that keep adding up day after day, month after month, years after years, crisis after crisis. And they're being ignored. Throughout the lifetime of a person living with sickle cell, the impact of mental health is debilitating, profoundly. For caregivers like me, it's heartbreaking to watch. You often ask yourself, how can I help my child? What can I do? So it leaves us with feeling of anger, frustration, and helplessness. No parent is equipped to deal with all this. We know we must stay both mentally and physically healthy to deal with sickle cell, but there is a pitiful lack of resources to support us in this. Healthcare, time, social, financial, network, everything. Where is the support when you are even handed the diagnosis of a child living with sickle cell, chronic illness, a lifetime condition? None. So over the years, for me, a few things have worked to help me support my mental health so that I can help my child. And they can be wrapped around 4 things. 1, acquiring, enough information to self-advocate. 2, the process of accepting the reality of the condition. And 3, asking for help. And 4, being kind to yourself, being kind to myself, self-care. Dealing with sickle cell requires, resources, both human and financial. But the most important thing is that you must take care of yourself. I focus my thinking on this, that a child mental health is supported by the parent's mental health. So you are the role model for your child. So I had to make sure that I was always both mentally and physically fit so that I can help my child all the time. So let's take action. Let's start the conversation about mental health, and let's actually have the conversation and take action. We need to change things for ourselves. Nobody's going to fix it for us. And we have to drive the agenda for a better mental health together as a community. Thank you.
So I would like to thank again Desio and Biba for their great testimonies. So now we have the 2 speakers presentation, but I would first ask Mary if there are some feedback in the chat, or do you want to give a feedback before we go ahead with the presentation?
It's Zakaria from Bahrain saying hello to everybody.
Hello.
That's the
Okay.
Hello,
Hi.
Zakaria.
President, how are you? Missing you.
Yes.
And as always,
Thank
you
you for
guide us
coming.
to the hope. You're encouraging us to do much more. Thank you.
Can I ask Zakaria? So I'm married to a Palestinian from the Middle East, so I've got a little bit of an idea of the culture, where mental health is really not something that's very easy to talk about. Is that right where you live as well?
Yeah, because people, they look at sickle cell like we are weak, unable, abandoned, and rejection. And if you go and visit psychologists mean, are you psycho? We are connected. We have a culture that we live within the community. We go mosque, we see each other, we hug each other, we walk. This is our nature. How people look at you, it's matter. We are totally connected. And how today it is very difficult to convince sickle cell people with sickle cell to visit psychologists and to talk to them, because they want to escape the stigma, but still they are in need for help. We face so many like fear. We experience death so many times, and palliative care is not there for sickle cell, and I recommend that palliative care to be included. And sadness, I'm afraid that to die, I don't know, I'm rejected, nobody wanted me. Even for children who go school and they see themselves missing their classes and trying to make good marks or to attend their classes, but they keep missing their classes, and during exam their stress will be more, so they will be absent. So they need help. Even their parents, they miss to attend their job, and that's will affect their income, and this is depression, will lead to depression. Add to that, also we deal with narcotic people. They don't want to talk about this, especially sickle cell. We are confused. Shall I take? Shall I don't? And we start to blame. Sometimes patient will complain about other patient. Why you are taking? Why you are depending on narcotic? People, they are confused. These complicated need to be organized rather to keep it just hide and hesitation. This will never end. We shall speak and we shall start speaking up. Then we can realize that we can solve this problem. Otherwise, if we hide our head in the mud, nothing will change. We shall speak up and shall ask for help. And I think the comprehensive care, the palliative care is important and shall start from the beginning, from day one, not when the problem started, no, before even. The counseling, the group session, how I have to teach my children about my medication. I have to teach my wife, I have to educate my wife. I have to educate my community about medication, about how much support I need. When I go home and in Eid time and I see myself alone with my mother, and when I ask about my brothers and sisters, where they are, they say they went for a vacation in Eid time, and they didn't told me just to escape me. It is 3 days, so they don't want me to accompany them, and I get my crisis there in their vacation, and that vacation will screw. That's how I see myself away from everybody. So the important of emotional health or mental health is very important to talk about. It is parallelly to do. If I want, sickle cell is not about only medication. It's about how to improve the quality of life, the mental health.
And thank you, Zakaria. And I can attest to the fact that when I'm in clinic and male patients are referred to me, most of them don't come because they don't see the essence. Most of my patients are females. So that negative perception about mental health services, yes, has to be addressed. Patients have to be educated to know that you are not weak. It is not a sign of weakness. but is rather a sign of strength when you need help and you seek it. Thank you. Thank you so much, Zachariah, for that.
Thank you. I'm also seeing some comment in the chat. So there is Naomi saying it's very difficult to open up because of the stigma attached to mental health issues. It's time to remove the stigma, and please, where we having this conversation, of course. And then there is Rigo. I'm sorry if I pronounce not properly your name. Thank you, Desio and Biba, for sharing your stories about mental health. Like you both said, it's already difficult enough for us to get treatment for our physical illness. The stigma and isolation for mental health can sometimes feel even more daunting. Subarna said yes, psychological therapy has to be normalized in sickle cell care. Not only, I would say, in all the world community needs to be normalized. I echo Noemi comment. Our community has to remove the cultural barrier that prevents us from seeking help for mental health. It is hurting us tremendously. I agree, Biba. Thank you for saying that. So we here all agree that mental health is important. Working on the stigmatization of mental health, it's also very important. So I'm very happy that we are here today talking about it. So now we can pass the floor to, then Miriam, we will retake the conversation just after. We can pass the floor to our psychologist. So first, Adrienne, who will talk more about the childhood and teenagerhood, and then Gabriella, the transition in the adult and parent phase of living with sickle cell disease. So please, Adrienne, the floor is to you.
Thank you for opening up the Congress to France. I think Biba and Desio and Zachariah have summed up perfectly all the different issues that I've put on the PowerPoint and how we can go about having a more constructive way of accompanying from the very beginning. I think Biba and Zachariah did from the very beginning, from the first days of life, that it's important that there's a double support, psychological and medical and social. First slide. From the first days of life, that it's important that there's a double support, psychological and medical and social. First slide. So the role of the psychologist in sickle cell care, it's been said, it should be routine, not stigmatized from the very beginning, that the family, the children meet together and can put into words. I think Zachariah said how important it is to be able to speak about it. And when the healthcare is just the medical part, there's a big lack of being able to put into words everything that Biba and Desio and Zachariah have said. The next slide. So sickle cell disease, say it's positive and negative, it's invisible to others. So it can be hidden and not spoken about because it doesn't show. And from the very beginning, the baby is completely normal and the parents are expecting a normal baby. Next slide. And what all the testimonials have said is how, certainly Biba, that the symptoms and manifestations come from the very first months of life. It's variable. It can be 6 months, 9 months, even earlier. And that it's unpredictable is extremely difficult for the parents and for the children. And Biba gave all the symptoms: fatigue, back pains, hand swelling, joint pains, fatigue, anemia, headaches, fever. There's multiple symptoms, and parents with a newborn baby have to cope with the symptoms and the unpredictability of not being able to know when there's going to be a crisis, when their child is going to have a painful crisis. Next slide. Well, sickle cell is a complex disease. It's very hard to deal with and to think about for the parents. For many of the parents, especially in France, when they have put together that sickle cell disease, or the word in French drépanocytose, which is impossible to pronounce, means a disease that they know in their mother countries, immediately they think of early death. And this early death weighs on the family, on the children, and is not often brought into the pediatric consultation to be expressed. It's a phantom that is in the consultation, and it's important to be able to speak about this from the first consultation when the baby's there, because with modern healthcare in most countries, access is difficult, but it does not mean early death. In Europe, it does not mean early death. And the symbolic significance that it's an inherited disease and it's a blood disease. And all this needs to be spoken about, because there's the unspoken is what weighs on the baby, weighs on the young child, weighs on the teenager, and then adult. And there's this implicit need for psychological support, but a light support, the putting into words. And as it was very clearly said, this is often not available. There's reticence to consult a psychologist. There's no financing, and it's ignored in public health programs because it's too expensive. Next slide. In all pediatric health plan, a psychologist is important, and it all begins when the disease is announced to the parents. And it is very rare that this announcement is in the presence of an accompanying psychologist, not because the parents need the psychologist when it's announced, but the pediatrician too, to see how the baby and how the parents are going to react to hearing that their baby has a disease that they didn't expect. And this psychologist there can put into words the different fears, the taboos, and then reduce by putting into words the psychological effects on sickle cell disease. And as the testimonial said, the parents feel guilty, they feel sad, they are ashamed, they feel very lonely, and they're very afraid that their baby may die before he's 5 years old. And the baby in the consultation is extremely sensitive to his parents' reactions. He knows something's happening, but he doesn't understand why. And so from the very first days, as Akahaya said, the baby feels that there's something's happened, something dramatic has happened with his life that up until the announcement was unknown to him. And so this accompaniment can liberate the thought processes, and when needed can facilitate a referral for some specialized care, but this is exceptional. If there's an accompaniment from the beginning, it's not psychological help that needs to be put into place, but an accompaniment to put into words all these different issues. Next slide. Well, the most crucial moment is when the diagnosis is announced. And it was said in the testimonial that often the diagnosis is thrown at the parents without being able to take the time to hear what the parents, what this means to the parents, what they heard about the disease and what they already know about the disease. Even though it is very important to put in the preventative measures from the first consultation, it's more important to feel what the parents are feeling about this announcement, and also the baby who's participating and how he's reacting to what his parents are hearing and what the doctor's saying to his parents. Next slide. What is sickle cell disease? It's a known and feared disease. It's completely unknown often for some of the parents. In African language, it means the cold that grinds the bones. In Bambara, it's a blood disease. It's anemia disease, but it comes as a bomb when the parents, as I said, put together what the doctor said, sickle cell, and what they know from the country that they have left. Their baby, who has been healthy for 1 month, 2 months, 3 months, is no longer healthy. He's now a sick child. He has a serious, incurable chronic disease that will necessitate lifelong care. That this disease is inherited, and due to a blood anomaly is heard by the parents. And the hardest to deal with, and that was said very strongly by Biba, is that he will be subject to intense, painful crises that are unpredictable. And for any parent to see his child in pain and not to be able to do anything about it and feel perhaps that he is responsible needs a psychological accompaniment, so not to be alone with this fear. Next slide. The announcement is painful, brutal, destructive. It creates an irreversible life change. And even if one child has already been, has sickle cell, as everyone knows, it can be more than one child in the family that has sickle cell disease, but that doesn't mean that the announcement, the diagnosis, is any easier for the parents to hear about. It lends confusion, loss of identity, guilt, and the whole family is affected. If there's other brothers and sisters that are not sick, what does it mean to have a child who's sick? If there's other children that have sickle cell disease, why another baby? And the doctor must find a way to announce this truth to protect the child and the family from any kind of suffering, and to open the road for the future from this very first consultation, that there is a future that maybe he can't do everything that he would like, but this is learning frustration. There's, for all of us, we cannot do everything that we would like to do, but to find a path where the child will be able to have a quality of life that is satisfying for him, for his parents, and for his brothers and sisters. Next slide. And this is, we did a study in France with a pediatrician, Dr. Audievre-Montagnier, about the impact of having a tandem psychological and pediatric accompaniment from the very beginning. And what was interesting was the drawings of some of the children. The drawings are normal, but you can see the psychological repercussions due to the sickle cell disease. And this drawing where the child was asked to draw a woman walking in the rain. And the umbrella there looks exactly like the death sickle, doesn't resemble very much an umbrella. Next slide. They don't come through very well. But you can see that for one child, the body is not grounded. He's floating in space. Another child where there's lack of adequate protection from the rain. He's covered with the rain, but his umbrella doesn't protect him at all. And in the third design, there's many more, but these were caricatures of some of the issues, that his body has no substance. His body's just like a hanger with no hands to protect him from the rain. Next slide. And then the parents are caretakers, and Biba said this very, very poignantly, that the parents must assure the medical responsibility necessary for sickle cell care. Parents don't usually have to have such responsibility every day. They have an overwhelming fear of the crisis and a helplessness in front of these crises. And so this parent relationship, and this is where also psychological accompaniment routine is helpful, because parents can be overprotective because they want to prevent anything bad happening to their child. They can favor excessive dependence on the parents rather than autonomy, which is empowerment. Or they can go the other way and denial of the risks, and sometimes not respecting the medical advice and putting their child in danger. A bit like Decio says in the part, what he wrote, but was not on his video, that not wanting to believe this, and so not giving the medical treatment that is necessary because somehow it's too hard to believe that their child is sick. Next slide. a child with sickle cell disease in France has an average of 1 week of hospitalization per year. This is on the average, this is enormous to me, but nobody likes to have their child in the hospital, and 1 week a year is very much. These hospitalizations mark the children and influence their development. The hospitalizations can be reassuring for the parents because they know the hospital is there and the hospital will take care of their child, but this is not necessarily true for the children. These frequent painful crises are traumatic events. And so psychological support is important for both parents and children, as well as other therapeutic proposals that can be help living with sickle cell disease, as there's medical hypnosis, music therapy, clowns at the hospital, and therapeutic education to have more knowledge about the disease and how to take care and anticipate by the parents. Next slide. In conclusion, the psychologist, my idea of the psychologist is as a translator that puts into words the overwhelming emotions felt by both parents and children. Doesn't necessarily have the answers, cannot bring quality of life, but can be this translator that helps putting into the words. And when these fears and anxieties are expressed in words, this is a liberating process that then facilitates the acceptance of the constraints of living with a chronic disease, sickle cell disease in particular, but any major chronic disease. And then the parents and children are able to construct realistic plans for the future. Not frustration, but realistic plans in relation to their child and his health. And also the psychologist can serve as a link between the traditional culture and practices of the family and the biomedical techniques of the hospital world. So the traditional culture and the traditional medicine is very important for many families that are often reserved and don't want to tell the doctor what they're doing, but this is also very important for accompanying the children, that it's not exclusive. Traditional culture and the biomedical techniques of the hospital world. The psychologist encourages autonomy as well as empowerment for the children and for the parents. And as I said, for some children, if there are school difficulties or other difficulties, then can access to more specialized consultations when it's available. And that's the last slide, I think. So thank you. Attention to psychological implications ensures a better quality of life.
Thank you very much.
Yeah. Well, good afternoon. Thank you for inviting me to share our experience. So as Adrienne said, attention given to psychological implication of sickle cell disease assures a better quality of life. But note that. Therefore, we must pay attention to these implications along the different moments in life. So the first slide. Adolescence is a time of crisis. It happens a lot of changes at this time, at this moment. It's a period of life where there are many changes and adult subjective position is being acquired. So adolescence implies leaving behind childhood. It means separation from the parents and considering parents as the ones who guide and organize the priorities of life or daily life. There is also an expectation of gaining autonomy, that this is something that is result of a process, and the process starts before adolescence. There is a moment when relationship with peers is very important, and when parents have to be able to gradually let children take responsibilities, make decisions, and assume certain risk in order to promote autonomy. So at this period, adolescents have to find his or her own place in their group, build a social network, learn if it is better to say yes or no without having their parents' help to deal with the group as when they were children. Body changes, sexuality is very important, as well as the changes in the way of thinking, because they are capable of abstract thinking and start questioning about their place in the world, the meaning of existence, and the meaning of life itself. So it is a moment in which future appears not as when I would be adult, but when becomes real. Living with a long-term condition like sickle cell disease during adolescence constitutes a significant challenge. For adolescents with sickle cell disease to be cared for and supported appropriately, it is crucial that parents and health professionals have a comprehensive knowledge and understanding of how they experience living with the condition. The next. It's a time when the future appears as the next exit. So there is not the next one. There is not a one-size-fits-all to cope with sickle cell disease. There is no a good way to deal with this challenge for everyone. Each one must do his or her own process to find their own way to deal with this chronic disease. And as it is a process, the adolescent requires time and adequate follow-up. And that's the reason why mental health professionals are necessary, a part of a team. When the psychologist is involved in the treatment, science diagnosis, parents and adolescents tend to ask for help when needed. At this time appears a lot of questions about disease and treatment. Despite the years of follow-up, they wonder about the need for treatment. For example, an adolescent this week start to ask, why do I take hydroxyurea and penny level if they don't cure anything? So it's a time when it is necessary to talk again about the disease, about the silent damage it produces, the difficulty of infections, and the convenience of antibiotic treatment. It is a time to talk about their tastes and habits, to be able to explore how to accompany them to find the things that give them satisfaction in life. And this is different for each person. In this sense, stimulating from a young age to find things that they like and that are compatible with the disease is very important. The next one. That's why we work as a family-centered care. So it is important to work with parents in order to support the children looking for the things that do well. So these are the challenges that an adolescent face. Above all, they have to learn to deal with the constraints imposed by their condition. When they were children, their parents put the limits, made decisions, and helped them to deal with frustration. But at this moment of their life, there are a lot of limitations that the illness imposed to them. So adolescents with sickle cell have to adjust to the constraint of living with a lifelong chronic condition and developing compliance with self-care and medical treatments can be problematic. Because social functioning, it is also an important issue because their experiences are different from those of their friends, and they sometimes miss vital moments because of crisis of pain or admissions. So it is difficult for them to find their place in the group. Sometimes parents overprotect them and so don't let them to have their own experiences. So it is difficult for them to deal with this condition, and they have fears of a stigma, of stigmatization. There are a lot of factors that contribute to stigma in sickle cell, not only disease status, pain, and use of painkillers, but also sociodemographic characteristics. And it is difficult for them to explain and tell others about, talk to others about the disease. So disclosure is also a thing that we must address in the follow-up, because it is difficult to reveal sickle cell condition to the others or speaking with others about illness. But we all know, and there are a lot of studies in this sense, that people with sickle cell disease that can speak and talk to others, family, friends, about their pain, have more positive adjustment and are more likely to seek care and have lower awareness of stigma or stereotype. But adolescents are also at risk of internalized stigma and feel depressive symptoms, including feeling hopeless and loss of interest in daily activities. All of these have been associated positively with stigma, internalized stigma. Another important issue is that they can't play sports or do physical activities, and frequently have problems at a school with the sport teachers. We have a lot of work with the schools in order to speak about the disease, because as Adrian told us, it's something that you can't see, and frequently teachers think that children or adolescents are lazy or doesn't want to work or are not serious at work, at a school. Sickle cell disease also affects body image. There is a very frequent complaint about yellow eyes, or sometimes they have other problems. For example, an adolescent that doesn't want to go to school because he had thrombosis in her limb, and so she was ashamed to go to school, thinking what their colleague would say. So many patients refer feeling uncomfortable with their image. This also leads to problems of self-esteem and self-confidence. The earlier we detect these problems, the better we can help them to solve. We found something very, a contradiction in adolescents with sickle cell, because they may be more mature in their awareness of what matters in life, but they also experience estrangement from their peers, as well as lack of resources and social skills. So how to deal with that feeling different? What to do? The next one. What to do? Well, which are the important issues to address with adolescents? Well, so what are the important issues to address with them? What do must speak when we are in the consultation with them? The first, knowledge and understanding of the condition, because they change and new questions may arise, and it is important to maintain open communication. Then, symptom experiences. Each individual has its own relationship with his or her body, so each one experiences symptom and especially pain differently. It is important to identify which are the best way to deal with it for each one. A variety of psychological characteristics are associated with pain, including coping strategies, anxiety, depressive symptoms, and stress. We must pay attention to each adolescent and help them to identify and communicate symptoms as soon as they appear. Then, self-management and healthcare experiences. We must help them to pay attention to what they feel, to get to know themselves, to identify what helps them and what makes their situation worse. Learning to communicate their thoughts about the disease to adults, asking questions, beginning to participate in decision is very important, and they need the adults to stimulate and promote this process. This is linked with adherence and attitude to treatment, because it is frequent to find that adolescents go through periods of poor adherence. It is important to talk openly about it and negotiate with them about the treatment. We must ask also about social relationships, being aware that, as I said, it is central in this period of life, and it is important to talk what to share and what to talk with others about the disease and treatment. Because what we find is difference and striving for normality in them. There is always a feeling of not having a normal life. So it is important to talk about the difficulty that the disease supposes, but also to help them to realize that life puts many difficult circumstances ahead of many people, and the important thing is what one does with the cards that have been dealt to anyone in life. In this way, we can help them to see that their life and their identity is much more than sickle cell disease, and we prevent them from turning the disease into a stigma, a barrier, a destiny in their lives. This is difficult, and it's a process, because it's true that, for example, the school experience is highly disrupted by absence due to crisis, hospital attendance, and admissions. In each case, the process must be accompanied, although in our experience, we see that patients have great difficulties in attending school. So we must address emotional well-being and coping, and also sexuality. And this last point is difficult in the pediatric setting, because usually patients came with parents, and so it is a process to start having a special consultation with them, or a time in the consultation with them to speak about sexuality issues. The next one. What we know is that subjective perception about sickle cell impact in their lives is a key element in emotional well-being and quality of life. We can help them to adjust goals and expectations. This is something that everybody has to do during adulthood. But with adolescents with sickle cell disease, we must help them to integrate sickle cell disease to their identity, as well as feel their life it's much more than sickle cell related issues. The next one. as adolescents is a transition. At certain point, you have to cross the river, the next one. So transition to adult unit. The goal is the continuity of care, and this is a high-risk period associated with increases in hospital admissions and death. The factors underlying this increased risk include not only characteristics of the disease itself, with the accumulation of disabilities and progression of organ damage, but also psychological factors and frequent paucity of adult care resources. So leaving the familiar pediatric team can cause marked anxiety in many patients. As we have said, transition of care coincides with many of the other transitions that characterize this time of life. So the shift from protection by parents and physicians to independent self-management may be difficult. The transition must begin early, involve both pediatric and adult team, direct appropriate attention to the parents, and occur over a period of several years where we can work with parents and adolescents in order to start caring themselves. So for this happen, it is necessary that they establish a relationship of trust with health professionals, that they get to know adult doctors and establish a relationship of trust with them. Confidence in medical decisions and the belief that the doctor is one of those who cares and helps to live better is the best to poor adherence. The best antidote to poor adherence is confidence in doctors. Then a very important aspect that Decio talk about in the blog, a very important aspect that appear in adolescents is the overuse of painkillers. It is a very difficult topic to deal with. On one hand, it is important to have easy access to opioids and other painkillers, but we must educate about responsibility in the use of them, and we must be vigilant when we see excessive use so that this not become a taboo subject. The worst is that it becomes something that's not talked about. The next. We have identified several follow-up barriers, and it is important to address this. It's important to know. One is the relationship with the pediatrician, because sometimes families felt fear of abandonment, and they are afraid of abandonment and experiences difficulties transferring trust to the new team. Also, lack of knowledge or understanding the sickle cell disease and the risk it has, because you don't see the illness, and sometimes they negate the symptoms. It is very often in adolescents to negate some symptoms. Also, because lack of access to healthcare facilities, and another important follow-up barrier is the psychosocial problems. So it is important to address in the pediatric setting. So I think that this is important, what Decio said, that being more aware of these issues help us to advocate for mental health service and to work better for future generations. Thank you.
Thank you, Gabriela.
Thank you.
Anybody that wanted to speak up about any of the ideas that were raised by the
Yes,
speakers?
thank you.
Yes, I was indeed reading the comments in the chat. So there are many people saying that there should be services available for patients following psychology therapy. And according to this, I would like to ask about services available for patients to our psychologists here today. Because now in Europe, we have a lot, at European level, we have a lot the idea of having psychologists as GP, so having them at the service of the population, just as GPs, general practitioner, well, GPR. So I would like to ask you, so you come from 3 different countries, so Ghana, France, and Spain, if in your country there are such services. So the first question are about available services, and if having those services just as we go to GPs could be a good proposal to advocate for. Thank you.
Adriana, do you want to start?
In France, psychologist is not like a general practitioner, and there is, as everybody has said, there are centers, people can go and have psychological care, but there's the stigma, the reticence, and when a parent from the pediatric point of view, when the parents have 1 or more children that are ill, the priority is for the medical treatment and leaving time from work to accompany for the different medical visits, to be at the hospital when a child is hospitalized, to take a child regularly to a psychologist is it's not feasible. It's not even imaginable, because the stigma of consulting as to why the child has sickle cell disease that we're not talking about, and now he has psychological problems. And in many services in France, the psychologist works with the pediatrician, and I had the privilege of working with this pediatrician where we were always 2 in the consultations. So there was always attention to the medical issues and the psychological issues from the beginning. But this is a very rare situation, because the pediatrician has to be open to having a psychologist in his consultation, not just being alone with the parents or the patient, and no one ever knows what happens in the consultation because there's no observer. And that the psychologist accepts working with the pediatrician. So there are many experiences where the pediatricians work with, especially therapeutic education, with the nurses or psychologists to provide information and awareness and trying to deal with this disease and going towards better quality of life, but not as a general practitioner to consult privately in the community.
Gabriela, you wanted to add?
Yeah, my situation is similar in the sense that I am in the team at a hospital, so I stay with the pediatrician at the consultation. Sometimes parents, when we do diagnosis, it's the pediatrician, the psychologist, me, and a nurse. So they know us from the beginning, and so it is easy to ask for help when the children has a problem, because psychologist is part of the team. But I have to say that it is not common in Spain. There are big hospitals where there is a psychologist, but it is not very frequent. And I agree with Adrienne that it is difficult for families to go to clinical psychologists outside the hospital, because medical care, work, daily life, it's difficult to include, go to another visit. But when mental health professionals are at hospital, for example, I try to see the children or the adolescents when they have the appointment with the hematologist. So we work together and it's easier for families to assist.
Thank you very much.
Let me add the Ghana experience. So in Ghana, generally, when it comes to psychological services, we don't have a lot of psychologists, even generally psychologists taking care of mental health patients. We don't have it. And we don't have a lot of psychologists. Then when it comes to clinical psychologists taking care of people living with sickle cell disease, I was the first in the country to be taking care of children and adults living with sickle cell disease. And as at now, I can't count more than 3. So I think the situation is similar, but one of the things that I think when it comes to Africa, they did was to use nurses to provide psychological services. But then there were challenges because a nurse is supposed to also be on a schedule. Then you are going to add another schedule to that. So there was work overload. So they weren't able to provide those services. So we have to think about innovative ways to make sure that people receive mental health services. So one of the things that they did in Ghana, generally, mental health services, was to use students who have finished first degree. So they call it the psych corps. So they are trained a bit and taken to the various communities to see if they can give education on, mental health conditions. And also if there's a person they can probably refer to, a psychologist. So that is what is in there. So the Global Alliance of Sickle Cell Disease is trying to see if, okay, we can train these people, if they are really able to provide psychological services, education and all that about mental health, then probably we can also train them such that they will have sickle cell knowledge and be able to also give education when it comes to sickle cell disease. So this is what we are looking at to see if it's feasible and we can implement it in low and middle income countries. So when it comes to psychological services, it's really poor, but then it's really needed. Thank you.
Thank you very much. So I would like to read one comment in the chat, then I will pass the floor to Janine and then Zachariah. So from the chat, we have a comment from a physician. Keep attention to sleeping difficulties, which are very frequent in adults with sickle cell disease, add stress and contribute to poor quality of life, fatigue, and frequent vaso-occlusive crises. We need also non-pharmacological alternatives to solve these problems, and each patient has to search for its own solutions. So this is one comment. I will read also these other 2 comments and then pass the floor. Great session, thank you. Psychological service is such a yet very understaffed and underfunded aspect of care in sickle cell disease. It is important to offer these services to families and more. So in this, sorry, the chat is dropping, in the transition age, so they better understand how therapy can support with managing their condition. Last comment, it is crucial to have a comprehensive care model for treating sickle cell disease, comprising of services like mental health, diet, nutrition. Indeed, I think we all agree on those comments. So please, Janine, you can unmute yourself and have the mic.
Thank you. I just wanted to say a comment about in regard to Gabriella's presentation of transitioning in adolescence. And one thing that's really not told to us when we're transitioning from pediatrics to adults is when you're going to hospital, you'll come upon times where people won't believe you or won't believe what you're saying. And that has such an impact on mental health as an adolescent, as you're transitioning, and even as an adult. I still experience it today when there are moments where I'm like, I need to go in to get emergency help, but I don't have the mental capacity to deal with what they're going to throw at me because I don't know what they could throw at me. Every time it's different. And I think that has a lot to do with the trust that we have in our healthcare systems and wanting to go to treatments and appointments or wanting to get emergency help because we have that fear inside us that, oh, maybe someone's not going to believe me this time and I'm going to have to fight. I'm going to have to advocate when I'm in a lot of pain and I might not be able to do it properly. And, you know, there are times as an adult where I've had to call my dad and he's had to tell and explain to the doctors what's happening because they're not believing me. They're not understanding me. So I don't think it's totally correct to say that, you know, we take full autonomy on our adult care because I've been told plenty of times, like, you're the only one that knows your sickle cell, but a doctor will turn around and tell me, but you need this medication. So if I know my sickle cell, why are you telling me a medication I need that I'm telling you I don't need? There's a lot of things that happen, a lot of experiences that happen that impact patients' mental health using healthcare services, which isn't spoken about. And I just had to point that out. And I also wanted to build on the fact of, you know, drug abuse, of these strong opioids and narcotics that we're given to help deal with our pain. Yes, they're very positive and they can have a lot of good effects on our pain, helping us get through crises. But yeah, they are also very highly addictive. And yes, we as adults have, you know, burden on ourselves to hold ourselves responsible, but I don't believe that doctors or clinicians hold themselves accountable for prescribing them in the doses that they do. I remember 5 years ago, I was on immediate release oxycodone, modified release oxycodone. Every 4 hours, take immediate release. Every 12 hours, take your modified release oxycodone on the highest oral prescriptions that they could have me on. That's what I was on every day. And my pain wasn't getting better. And the doses were just going up and up. And I was getting more and more depressed because I'm having to now rely on this opioid to get me through my day. And it wasn't even to help with the pain anymore. I had to take a step back for myself and realize that nothing was helping and nothing was changing. I needed to stop taking this medication, where there are a lot of patients still today getting the wrong information, I feel, on dosage and on timing and how long you should really take strong opioids for. I know sicklers today that are on such high doses of medication and they've told their doctors, I don't want to be on this medication anymore. And the doctors turn around and tell them, your pain is so bad, you need to be. We're not going to change your treatment plan. And that's not right when the patients come into their doctor and say, we need to change something. And doctors turning around and saying, no, we're not. I mean, so many of these experiences happen with so many patients every day all around the world. And that has such a big impact on our mental health. Yes, that's all I wanted to say. Thank you.
Can I answer to Janine 2 points? I think one major point going from pediatrics to adult is the pediatric services know the children and are, when a child comes in, he gets priority care. The emergency for anybody in France, emergency care it's overwhelming. That I think that people with sickle cell disease should be prepared ahead of time to know how often the emergency services, except in reference centers, are not equipped, they're not informed to deal with sickle cell and crisis. It's often interns that do what they think is best, but it's not best. They say whatever. And for the drug abuse, and it was Desio that also made me very aware of this, it seems to me the problem is not drug abuse, but crisis, pain and dealing with pain, this excruciating pain. The medicine has been given, and as you said very clearly, what happens with this medicine, but it's not drug abuse, it's pain. And how do you deal with horrible pain? And then it goes into a cycle that becomes perhaps addictive with the drugs, but it's not. And I know that people say, here comes he has a drug problem, he's an abusive problem, he's asking for too much. But it's the pain behind it and dealing with this pain that started when the person was a little baby.
Yes.
Gabriela, you want to add something?
I wanted to add something that also medical education, it is important, because when the psychologist is in the team, doctors also learn. We psychologists learned about the disease, but doctors learn about the importance of talking with the patients, of listening, the importance of their words in order to communicate something. And so I think that everybody wins in the interdisciplinary team.
I totally agree with that. When I have rounds with psychologists along with the doctors, they always go a lot smoother. Everyone leaves happier than when you have just doctors who are just there to do a job. It can be very impersonal and very like you're not feeling heard. And I think that is the problem with a lot of sickle patients, just not feeling heard in their own care.
Thank you.
I also wanted to add that when it comes to the pain measurement, it has to be culturally sensitive, because some of the pain measurement instruments are not culturally sensitive. And I think that is how come doctors are not able to really, or health professionals are not able to really understand the patient. So I think the pain measurement instruments should be looked at to make sure that it is culturally sensitive, so that it is measuring the right pain for that particular individual.
Thank you to all of you. So, Zachariah, do you want to intervene?
Yes, thank you. Just to remind you, I think Gasco and each of us here who work for advocates or help patients, as I said, we have three products. We have awareness, the first product. Second is responsibility, and we encourage people to act responsible. And that's why we ask parents or doctors or even patients to act responsible. And we provide hope. And this is the third product. For example, in Bahrain, as I am patient holding number 1 or patient 1 with sickle cell, so media know about me, families, they following me just because they want to check I am okay, I'm well today. So I'm standing like to provide or to show the hope for that mother who thought her kids may die or may not see her birthday 18, or he cannot be a doctor, he cannot be something. So we struggle, we fight, and we bring hope to these people. We bring hope that things will be changed. It matters. It matters. It will change. And these people is losing hope and losing value, especially in the adolescence, in the teenage, when they see their colleagues, they sleep and they wake up in CPR team trying to secure, save his colleague life, and he may die. He will live in darkmare, and he see himself any time in his position. And afterward, he see there is no value. Nobody is visiting him. Nobody is asking him. Everybody is ignoring him. Then we will see the anger, misdiscipline, and misbehave, and something it is very difficult to control. The cost will be very high. Even in the school, while they search for the proudness in their parents' eyes, they see nothing, or they see it little. Or even in the other way around, when our kids go on the stage and they are awarded because they were good at school, and they see all the parents around their colleagues, and they search, their eyes searching for us. They don't see us because we are hospitalized. They are depressed. And these type of pictures will draw the deep sadness. One time, there is one painting exhibition made between our Bahrain Sickle Cell Society and American Embassy. And less people attended because it was cold weather at that time. And the ambassador came to me to apologize because little people came. I said, no, never, because I took him to my son paint, and I show him the difference between the paint he used to paint 2 years back or 3 years back, when he used to paint me on a bed and lying down and receiving a blood. And in that day, I saw my son draw a mountain, a flower, a river, flag, a bird, a sun, clouds. What it reflects the safe. That's mean what we did in the healthcare, improving the healthcare system. We have today a multidisciplinary clinic, and we have the psychologist, we have the specialist with us, the counselor. That reflects not only on me, it reflects even in my kids. When they felt safe, they are living normal like other kids. They are drawing normal like other kids. Now they feel their father is being secured and safe, and their family is being saved. This is very deep, very deep. This is it shows the importance of the mental health, the importance of multidisciplinary team, how it can reflect not only on the patient finding the self-esteem, or to make them behave or perform well. It's affect the community, family, and the community. Today, I'm very proud to say I have so many success stories, not only in Bahrain, it's everywhere. That's why we call ourselves warrior, because we don't accept that to lose a war, or we are going to win, and we cannot win that alone. We have to do together. We have to support each other, and we have the first to trust each other. We need you, and we are going to provide, we will continue to provide the hope. Thank you.
Thank you very much. Thanks a lot. I don't know if anyone wants to comment on Zachariah intervention. If not, I will pass the floor to Miriam.
Yes, I think Zachariah talked a lot about support groups, and the kind of support he's giving others, which they feel belonged. So support groups are very, very important in this work. If we have to deal with people living with mental health, it's not just the psychologist, but I think support groups, they do a lot. So when it comes to sickle cell, it is important for the support groups to start supporting their members wherever they are. Then it's important for us to also come together under a unified voice, like the Global Alliance of Sickle Cell Disease Organization, so that we can champion the cause for people living with sickle cell disease. So Zakaria, thank you so much for helping us to understand the importance of support groups in dealing with mental health issues when it comes to sickle cell disease.
Thank you. So Miriam, you can unmute yourself if you want.
Hello. I just have two brief things. I was checking in the chat while the presentations, two things that slipped, and it's specifically about mental health and adult. So fortunately, I remember that when I was born, life expectancy for me was up to 5 or 6. And fortunately, that wasn't the case. And many patients today reach their 50s or 60s if everything is good enough. And there are increasing cases of people reaching the 80s, even the 90s, but I think that's more difficult. But there are a lot of issues of mental health in adults. So these two presentations were really important for children, child parents, and transition from child to adult. But the growing numbers of sickle cell patients in adult life with a whole different range of challenges, it's really important also to discuss and to focus. Yes, the support groups are really important, but there has to be some professionals in there that help us to find the tools, because one thing is talking to other people that may have the same problems and find alternatives, discuss that in this area, this is available or this is not, or maybe you can ask for this or that. But a professional is a professional, right? It gives you a complete different set of tools. Many people don't want to share some details publicly. So it's a completely different conversation, which also needs to happen. And it is a fact that many times it is related to the GPs. The GPs, at least in the UK, know a lot less about sickle cell than would be expected. And even if they know and understand, they are very limited by what the NHS provides. And the psychological support is just one side. And for example, I am followed at Cambridge at Addenbrooke's by the Hematology clinic. And we have a good support group that includes hematology consultants and nurses and everything. And we have a session once a month where we focus on different aspects that patients ask to talk about. We had a session on psychological support, but there simply is no funding to have a psychologist to follow the patients in Cambridgeshire. So it's a reality. It's money again. So I just wanted to focus that it would be really nice to have also a slot to discuss issues for adults with sickle cell. Thank you.
I think that it is very important, Miriam, what you point out. I can speak about a very recent experience. We are starting with ASAFE, that it is the patients organization in Spain, experience of conversation groups. And I agree with Miriam, our conversation groups are patients, adults one day and families of children another day, but the groups are coordinated by a psychologist and a physician, because I think that it is important trying to take the interdisciplinary model of the hospital setting to the conversation groups.
Thanks for sharing. So I can see Alero has raised the hand.
Hi, just following on, I think it was Miriam's comment about not having access to psychology. So if you contact the specialist nurse in your trust, number one, and if you have a support group, that'd be good. So you go collectively. That would be your first thing to say this is needed. And also, we do a lot of benchmark with other conditions. So if you have diabetic, a lot of the diabetic services will have a psychologist. So find out what your trust is doing. Neurologists, specialist clinics also have psychologists. I had to do the same for my trust. I'm a registered specialist nurse. So find out what they're doing with other specialty. If they have a psychologist already, and then you can tap into that. Sometimes they have a psychologist and maybe your cohort group is not a lot, and then the same psychologist can share their clinic appointments with you. Sometimes you just need to work with the trust, and that helps a lot. They probably have 1 or 2 psychologists already in-house. So just find out a bit more. I can share my email if you want more details on how to work with the trust to get this service established. There's ways around it. I know you always get told there's no budget, but sometimes it's who screams the loudest, kind of say. There should be ways around it in England anyway, because it is part of the NICE guideline that we should, to give a comprehensive service in that trust, this is part of it. So you're not asking for something that it's unusual. You know, I work in a local district hospital, and we've been able to get things like this set up recently.
Thank you very much. Okay, I think we have addressed all the aspects. So I'm very happy of today's session. I think it has been a very important moment for all of us. I think we will end our evening or our afternoon, morning, I don't know from what jet lag you are connected. So with good home messages, and the hope that in future this sensibilization that we have started in our communities to mental health will have added value. So I really want to thank all of you, the speakers, the testimonies, patient representative, the audience, for all your contribution. It has been very important.